Greetings and namaste. I am Barun Kumar Rauniyar, a biomedical engineer from Nepal, and I am one of the collaborator members for Clinical Engineering Division of International Federation for Medical and Biological Engineering and member of Global Clinical Engineering Alliance. Since 2011, I had been managing a project nationwide inventory and maintenance management of medical devices in Nepal until 2019. And then since 2020, I had been working as a consultant for World Health Organization until last August. I am going to discuss about the situation and development of biomedical profession in Nepal. Talking about the major institutions, the National Health Training Center of Nepal, with the collaboration of external development partners, introduced 12 months training program, that is the biomedical equipment technician program, in 2004, which was then in 2014 got upgraded to diploma level, that is diploma in biomedical equipment engineering for 18 months under Council for Technical Education and Vocational Training. And Nick Simon's Institute has been instrumental in developing and promoting these courses as part of its mission to enhance rural healthcare in Nepal. As of 2017, the total number of graduated biomedical equipment technicians was 177. The government of Nepal and the external development partners have deployed some of the BMETs in the district level hospitals of rural Nepal. And NSI conducted the follow-up survey of BMET graduates in order to understand the working status of those graduates in government hospitals in 2018. 129, that is 73% were responded. Among those 73% respondents, 29% was found to be in the other profession than in biomedical. That is, they changed their profession. And the most common reasons for changing the profession was due to further study, because they found it difficult to get job, because they don't feel job security in this profession, that is career uncertainty and unattractive salary. Talking about the bachelor's degree in biomedical engineering, sorry, College of Biomedical Engineering and Applied Sciences, established in 2005, and initially there were 48 students enrolled in first batch, which was the full capacity of the college at that time, and hence the first batch of 46 students were graduated in 2009, and I am one among them. Altogether, around 18 to 19 batches has been produced as of now. As there is not much opportunities in Nepal, most of the biomedical engineers choose to go abroad for further study and for career development. In Nepal, most of the career opportunities in the area of biomedical engineering are in the medical equipment suppliers and in private or government hospitals on contract basis. Permanent positions in government institutions are very negligible and can be counted on fingers. Talking about the major associations or societies for biomedical engineers and technicians in Nepal, a National Innovation Center, Nepal, formally launched in 2012 to create a hub for research and development in Nepal. It aimed to support innovators, entrepreneurs, and researchers in addressing issues like education, healthcare, agriculture, and infrastructure, which is also providing the platform for biomedical engineers for research and development in the area of biomedical engineering. During COVID-19, the Innovation Center played a significant role in addressing medical supply shortages, such as developing affordable ventilators and creating personal protective equipment for healthcare workers, an oxygen mini plant system to generate oxygen for healthcare facilities, a cost-effective device, baby warmer, named Nano Nani in Nepali, designed to provide necessary warmth for newborns in rural birthing centers, and a new generation mask with innovative filtering layers designed for enhanced protection and usability. Um, mm, and Talking about the Biomedical Engineer Society of Nepal, the Biomedical Engineer Society of Nepal represents and promotes the field of biomedical engineering in Nepal. It works to enhance the professional development of biomedical engineers and improve healthcare through technology and innovation. The society organizes events, training sessions, and collaborations to address the challenges of the healthcare system and promote the use of advanced medical devices. The scope of biomedical engineering in Nepal is growing with increasing demand for professionals skilled in maintaining, repairing, and innovating medical equipment, especially as the healthcare sector expands rapidly. West Nepal likely plays a crucial role in advocating for policies and initiatives to ensure that hospitals and clinics are equipped with skilled biomedical engineers to manage and maintain their devices. Similarly, the Biomedical Engineering Foundation of Nepal and Nepal Biomedical Association are also contributing to enhance and strengthen the biomedical capacity in Nepal. One of the major milestones which helps to strengthen the biomedical capacity in terms of recognition and strengthening biomedical profession in Nepal was the nationwide inventory and maintenance management program since 2010 to 2020, which was funded by KfW, that is a German development bank, which mobilizes more than 20 biomedical engineers and more than 50 biomedical technicians during the implementation of the program. The major challenges for optimal utilization of these skilled human resources are still the lack of financial support and the recognition from the government as a critical profession to improve the healthcare services. Thank you and best wishes and Happy New Year 2025 to all in advance.